At the time, honestly, I didn't think that it was no coming back from this. I felt like I was just dying.
132 over 78. Met Dupree for the first time about 3 years ago. There were some really dark days. It makes you cry sometimes, you know. You just really get these relationships that you develop with these people because you're just one-on-one.
He was very unhealthy, did not have goals. You know, he was suffering with peripheral vascular disease in his legs to the point where they were constantly causing him pain. Unfortunately, he lost his legs due to the illness.
He was really down and had a lot of depression.
This is GINA. How can I help you?
Goal of care management is to help patients manage on their own and manage all of their chronic diseases. So for Dupree, what we're working on is medication management, making sure that he's getting all of the right medications at the right time of day. We're also working on the disease education aspect to make sure that he knows when to call the office and when he's having a crisis, you know, where to go and what to do. We also have him on telehealth, monitoring his blood pressure every day, and heart rate and oxygen levels to make sure that he's stable.
Say, if one for the nurses and the doctors, I don't even know what really happened to me. But everything was wrong with me. It's not so much wrong with me now.
When he came visit here and we were able to get this care with him, his demeanor changed a lot more. He was not as depressed and downhearted. Now it's almost like he feels like life's doing better.
Still getting the prepackaged meds, so he's been taking those correctly. One of the things that the care team worked on for Dupree was getting him a power wheelchair because his wheelchair before was old. He had a couple falls where the wheelchair actually flipped backwards.
I fought for a wheelchair, couldn't get it. They stepped in. Woo! Boy, did they make a difference. I mean, like night and day. If it weren't for them, I probably wouldn't be here. I mean, they go out of their way to be sure I'm all right. Honestly, they do. You know, couldn't have a better team.
Dupree was enrolled in the care management program in September of 2016. And in the year prior to that, he had about 21 visits to the emergency room and 3 hospitalizations. Since September, we've been able to decrease that to about 5 ED visits and 1 hospitalization.
I got into the healthcare business because I wanted to help people. I wanted to help, you know, really make an influence in their lives. And this is just another thing that I can do.
It feels really good to work with the entire care team to make sure that all of his needs are being taken care of. And it also, you know, is really nice to see such a great outcome for someone and their quality of life to be so improved.
Before I felt like it just wasn't no tomorrow. You know, I didn't. Actually, I told Dr. Brett several times, I don't even care whether the sun come up tomorrow. That's how I was feeling. But today, I don't even want the sun to go down. I just want to stay up.